Hi, my name is Mary Richardson. I am a research specialist with expertise in human development and family studies, and I work at the University of Michigan alongside Dr. Patricia Hirschberger, who is the lead author and principal investigator. She's a nurse scientist at the University of Michigan School of Nursing. She leads a transdisciplinary team of investigators and highly skilled clinicians in assisted reproduction, and her research focuses on the emotional, practical, and ethical complexities families face in sharing information about their children's genetic origins. She has expertise in reproductive health, family communication, and health behavior, and her team's work centers on developing digital interventions to empower parents and promote healthy family relationships, especially in the context of donor conception. I am one of the authors of the article expanding the digital donor assisted conception tool to empower parental telling and talking, tell tool, intervention to the pregnant and early parenthood periods, findings from a qualitative study. This article was published in JMIR Formative Research. The findings reported in JMIR Formative Research allowed our team to complete initial work to understand the needs of parents to be and new parents to revise the current TELL tool to meet the needs of the soon to be and new parents. We are grateful to have the support of the American Society for Reproductive Medicine Research Institute, who acknowledged the importance of this work by providing funding for this study. Our research addresses long-standing challenges. Many parents who use donor assisted conception struggle with if, when, and how to tell their children about how they came to be. Historically, secrecy was the norm in donor conception, motivated by social, legal, and or emotional concerns. And in recent years, there's been widespread advocacy for openness and recognizing that early disclosure is associated with improved psychological well-being for donor-conceived individuals. To support families in this journey, we created the tool to empower parental telling and talking, or TELL tool, which is a digital psychosocial and decision support intervention for parents with donor conceived children ages 1 to 16. In our latest formative qualitative study, we sought to understand the needs of pregnant, expecting, and new parents, as well as clinicians, to expand the TELL tool for use at these earlier milestones. And through in depth interviews with 20 parents and 10 clinicians, we found four central themes emerged. The first was reasons for what mattered most. All parents valued openness, citing the importance of honest communication. Managing emotions, conflicts, and needs was also a central theme. And parents experienced a range of emotions from joy and pride to grief and fear of rejection. And partner disagreements on the timing or approach of disclosure were also common. This highlights the need for emotional support and guidance for these families. Third was the desired content of a digital tool. Participants sought practical advice on communication and disclosure specifics, like the how and the when, as well as age appropriate terminology. Additionally, parents wanted an opportunity to connect with others who might have gone through the process and content that gave insight from the perspectives of donor conceived adults. And lastly, the central theme of recommended design and usability features. Parents and clinicians desired a tool that was intuitive, customizable, and accessible in terms of cost and respects privacy. And both groups highlighted the great importance of evidence based content and multimedia options for different learning styles. Ultimately, the study underscored how vital digital, evidence based, and user informed resources are for families navigating donor conception disclosure, especially at the stages of pregnancy and infancy. We chose JMIR Formative Research because of their leadership in digital health research and their commitment to open access, as well as their peer review standards. JMIR publications, specifically JMIR Formative Research, is an ideal outlet for innovative interventions like the TELL tool, as it reaches clinicians, researchers, and families worldwide. JMIR's emphasis on formative and patient centered digital tools matches perfectly with our project's goals to share actionable insights and empower donor conceived families at pivotal moments in their parenting journey. So we thought it was a really good fit for us.